All right, hi Dean.
Hey, how are you?
Doing good. So you've been our customer patient for a while now, since April 2020, and I believe you've been with us for about 5 times now. And
Yeah, this is the fifth time.
okay, I would like to start asking you, what is your experience coming down to the clinic, the timings, the experience in the transportation to start, like the beginning of your procedure?
Well, let me add real quick. I thought of stem cells because I had um, cirrhosis of the liver. I had gotten sick when I had surgery, gallbladder removed, had a staph infection, almost died about 6.5 years ago, and just been doing treatments, but they're more just the treatments in the U.S. They're not really treatments. They just kind of keep you going in the state you're in. So I thought, what I've read up on stem cells, what it can do potentially might help. So I started coming here. But what I like about this particular location is they pick you up anywhere pretty much in San Diego. They drive you over the border and it's faster. They have the medical pass. And it's a simple IV, and they'll inject the stem cells along with a vitamin combination of vitamins. And it doesn't take very long, and it seems to be working so far. And it's definitely better than getting a liver transplant.
Tell me how much you feel that you've improved with the stem cells throughout this year and a half.
Well, during this time, when I first started, I had what's called a MELD score.
Okay, sorry.
So I was at an 18 MELD score, and after a year and a half of getting the stem cells, I'm down to a 9, which is that's pretty drastic improvement. Your liver can heal itself if you let it. Now I combine it with, I didn't drink for a year and a half. I take milk thistle supplements. I tried to do a lot on the nutritional side as well, and I'm getting to the point where I feel much better. Although I had a TIPS bypass, which some of you who are watching this may have heard of that, and that still gives me some high ammonia buildup because it's bypassing your liver for like a third of my blood each time it goes around. But eventually, if I can even drop a little bit more, and most of my blood tests are in the normal range now, which they were not before. Um, I'd want to have them resize the tips, and I might be in a good shape to just go on with a normal life instead of kind of living off of a lot of drugs that are very expensive, like Xifaxan I take, and I was taking lactulose, but it would make me sick for hours after I took it. And I found that drinking prune juice and taking the Xifaxan worked better. So I switched to that in the last year. But that wouldn't have given me a big jump in my MELD score. So yeah, you feel healthier. The vitamins help. You're just kind of letting nature do its thing in its own way, and it can find habitat in your body. But yeah, they're very knowledgeable and polite. Pretty much all the staff speaks English, or if you want to speak Spanish, you can do that too. Um, yeah, so I've had good luck with it. It's definitely been worth the money.
And Dean, you were telling me about how you were in this transplant list.
Yeah, they were trying to get me on it, or I was a candidate to be put on it, and basically now I don't need to be be on it anymore. And actually, they wouldn't even put me on it now because I'd be so low on the priority list to get an organ because my health is generally much better. That that's a good thing to get off that list. You don't want to. If you get a new liver, you have to take immunosuppressors for basically the rest of your life. So that opens you up to who knows what other diseases potentially. And sometimes those surgeries fail, and the average lifespan after you get those, it's not as great as you think. So I'm glad just to keep going with my rusty old liver, getting it fixed up hopefully, and with stem cells helping. But stem cells would be the main part of what I've changed and done the last year and a half.
And will you continue to do the stem cell therapy for your liver?
I'll try to. If I get to a point where I just feel good, then it'll maybe be once a year. But yeah, it has a lot of other benefits too. So.
Can you tell me about the other benefits that you've seen on your health?
Well, just little things like not as many aches and pains as I had before. I don't know if it's the stem cells or not, but I just feel a little bit healthier. I still have a little ways to go in my building up my energy for the day, but I think I can start taking some different vitamins that can help with that. But the best thing is I can get off of drugs and things like that. And so I'm not, for one, don't have to pay the cost. For two, they usually have side effects. Whereas stem cells are, everyone has stem cells.
Yeah.
They're just increasing the amount that I have.
All right, Dean. Well, I appreciate you sharing with us your experience coming to our stem cell clinic, and we look forward to having you back soon.
Okay.
Thank you.
Thank you.